Well, I don't know many people that really enjoy going to the dentist. It seems even scarier in COVID times for some. But getting a dental checkup has become more important than ever before. And I can promise you it is not that bad. Today, we welcome implant dentist Dr. Timothy Kosinski to our first show produced during the COVID-19 pandemic. Welcome to Celebrate Michigan, the show produced on the campus of Madonna University. I'm Chris Benson. Dr. Kosinski is not only an implant dentist at SmileCreator of Bingham Farms, but he's also an assistant adjunct clinical professor at the University of Detroit Mercy School of Dentistry. And today we're going to talk about the current dentistry regulations as well as the impact of the pandemic on dentists' offices. Dr. Kosinski, we're so glad to have you as our first guest for the first COVID show.
Well, thanks, Chris. It's nice to be here.
Yeah.
I won't wear my mask.
Oh, I know, but we're glad you brought it.
All right.
And so, what got you into dentistry? Let's start there.
Wow, that goes way, way back. I'm not sure. I was going to be a professor. I wanted to teach. So I was in the PhD program at our Wayne State Medical School. And for some reason, my dad was a carpenter. I don't know why, to be honest with you. I applied to dental school and was accepted, believe it or not, and the rest was history. It was just fate, I think.
So would you say you have a passion for dentistry now? So it sounds like at the beginning you kind of got into it and then grew to love it.
You know, dentistry always made sense to me. It's something that I migrated to, and I have a tremendous passion. I say that I'm very, very blessed because not only are we busy in being able to provide really, really outstanding service to our patients, people that are really in trouble for a lot of reasons, financially or in pain or aesthetically challenged. Their quality of life is dramatically changed. But, well, before COVID, I would be lecturing too. I would be around the country meeting different people. It's really, really awesome at this time of my career to be able to give back to the profession. It's a lot of fun.
Well, you mentioned COVID. We should probably talk about that. So take me back to March of this year, March 2020. 1 minute we're going about our normal lives, and then, we start hearing that there's a pandemic. And then I know very early in March, there was a decision here in Michigan that offices needed to be closed. So how did that roll out for you? What do you remember of the beginning of this pandemic?
Well, that was hard. Because we didn't really know exactly what was happening. And I'm not sure how the staff felt. We had to see our patients. And then one day, on a Friday and to Monday, we were closed. We were allowed to see emergency care, but we didn't really know what that meant.
Right.
People in pain. We had a lot of deliveries to make. If you were missing your front tooth, you want your tooth. Is that an emergency? Probably not. And we didn't really know very much about the process of the whole coronavirus, really. How is it transmitted? You have to remember, though, dentistry's been through a lot. We always wore masks. We always cleaned very well. All offices, we were exceptional early on. We went through AIDS. We went through swine flu. We went through all of those things. So it wasn't an alarming transition, but we were closed down. So it was a tremendous financial burden. We have our staff, a big staff,
Sure.
And we want to work, and we couldn't. So that was hard. It's hard to sit when you're used to always going.
Well, and I was sharing with you before the show, I had a personal dental emergency, and it was very scary as on the patient side. I thought, gosh, I'm being told that this pandemic is serious enough, but I've got an emergency. Called the dentist's office. They said, this is an emergency. You need to come in. And then I was nervous, what does this mean? And they said, well, really, it's more important for you to come in, the risk of not coming in and getting something checked out. And so I did, and was very glad that I did. But, I remember back at that time, there was folks in the office at my own dentist who said, we really don't know what to tell you at this point about what the future's going to be like.
Exactly.
Right now, we'll call you about a follow-up. So it just sounds like there was a lot of uncertainty.
A lot of uncertainty. You have to remember, Chris, we wore masks, we wore protective gowns, disposable things. We always, the staff brought their clothes in and changed into scrubs, and we have a laundry there. We always did that. But we wore masks to protect ourselves from you.
Right.
Now we're wearing a mask to protect you from me. So it's a different ballgame.
So right at the beginning, what kind of changes occurred? So it was just emergencies? Remind me, or was
Yeah,
it
in
completely
our
shut down?
practice, we were there on Tuesdays mornings. So I had 2 staff members there, and we were there. We answered phones, and we kind of triaged what was truly an emergency. We didn't stretch or falsify anything. If you had a bad toothache, or you broke a tooth, or if you had an infection, people can't walk around with an infection.
Right.
Even to this day, I think it's more dangerous with everything going around in the world, that walking around with an infection is not a good idea. So we did that for 9 weeks. We were closed down, yeah.
And I imagine at that time it was letting people know, calling. I'm sure you had to call all the patients, because I know there's so many appointments that are set up, and you try to wait. So I'm sure your staff was really going through it too, along with the
It was hard,
patients.
and I think the stimulus package helped. The unemployment helped. The staff to it wasn't enough, but it helped at least alleviate the financial stresses that we all would have. We all have bills. The bills never stopped.
Yeah.
So I think that helped a lot to alleviate things. And we just wanted our patients to know that we're here for you, but we have to respect the boundaries that were set up by the state and by the CDC. Our dental society, our dental association, American Dental Association, our Academy of General Dentistry, our Michigan Dental Association are really, really good about letting us know what we could and could not do. We had lists.
Which is very helpful. And like you said, you've been training for this. Again, I guess I didn't think about that. The fact that, when I'd go to my regular doctor's office, they wouldn't wear a mask, but there was, for so long, dentistry was ready for this. I'm not sure anybody could have been ready for all of this, but it sounds like because of the experience you had, you were able to put things in place so people could at least feel comfortable for the emergency things that had to be done.
Exactly. And we've always cleaned really well. Rooms are always sterilized very well. They're cleaned down really well. Our equipment is always autoclaved. So that's always really helpful.
Something that's been
we felt good about it.
Yeah. Well, I know we have to already take a quick break. We'll be right back, and we'll get more on the safety precautions from Dr. Kosinski's office and what you can do to be safe going to the dentist. Stay tuned.
And finally, biology.
1 in 7 million. Who
among you will step up to their challenge?
1.2 billion. The odds of him having a child diagnosed with autism? 1 in 110.
Take on the tough classes now. You need them to prepare for college.
Learning how to kickflip 6 stairs takes determination. So will getting into college. I've got what it takes. So do you.
Yo, check out this chef, right? Right? That's so gay. That's really gay. Dude, look at those hands.
Please don't say that.
What?
Don't say that something is gay when you mean that something is dumb or stupid. It's insulting. It's like if I thought this pepper shaker was stupid and I said, man, and this pepper shaker is so 16-year-old boy with a cheesy mustache. Just saying. When you say that's so gay, do you realize what you say? Knock it off.
Sounds like you could use some Van Gogurt. It's fortified with arch-rich nutrients to improve your math and reading skills. Catch.
Van Gogurt, thanks. So what's the deal with your ear?
Always with the ear, huh?
Feed your kids the arts. For 10 simple ways to learn how, visit AmericansForTheArts.org.
Welcome back to Celebrate Michigan. I'm Chris Benson, and today I'm here with implant dentist Dr. Timothy Kosinski, and we're going to talk more about the safety precautions in his own office in Bingham Farms. Dr. Kosinski, we talked before the break about, the PPE, which is a term that I wasn't familiar with until March, right? So that's like personal protection equipment, but I understand you've also done a lot of things inside your office in addition to that, so that you can take care of business in a safe way. Right. Tell us about a few of those things.
Well, Chris, when everything happened, we all, the world was hurrying to try to find things. We were worried, we have masks, but how many do you have? Gloves, shields, goggles, glasses, and it was hard to find things. The N95, that's kind of a new concept, and then the NK95. There's so much out there, and we were all hustling to try to find things. And so we went through a mental process, at least in our practice, and I think most dental offices. And again, going back to the American Dental Association, the Academy of General Dentistry, these large organizations that work with the CDC to determine what we need, how we should be doing things. And maybe initially we went overboard with our protection. We were worried about ourselves. But that kind of transitioned into protecting our patients.
Sure.
Okay. So the first thing, temperatures and a questionnaire. We don't fill our waiting room. None of the offices are filling our waiting room. We have people wait in their car.
Which is such a new feature. I know veterinarians, doctors'
absolutely.
offices.
Social distancing is important. You must come in with a mask.
Sure.
If you don't, we provide one for you. We put plexiglass shields, sneeze shields up.
And I think we have pictures of some of this. So actually,
we can show that if you have that. That'd be great.
Thank you for bringing those so we can help people.
Well, that's me.
Hey, there you are.
Early on, as you were saying, really trying to protect ourselves. Disposable gowns, keeping everything in the office, different shoes, not taking this home to our families.
Right.
But we also bought a lot of equipment, a lot of things. Here's our plexiglass shield in our front office area. Hand sanitizers everywhere, constantly wiping things down throughout the practice. And I think the staff understands it. We have foggers to keep our viral count down in the rooms.
That's what that is.
That's what that is. Yeah, it's a ray gun. But in between patients, we clean the rooms, we clean the countertops, our lab, where the patients sit.
Okay.
And these are all important things, little things that help us. This was something that we bought that I really, really like. It's a plasma decontaminator, and it's really awesome. We put several in the office, and it covers a fairly large area, but it brings the viral count down significantly. So that was an expensive investment, but something that I really, really appreciate. I really like that. We put HEPA filters throughout the office. We bought a ton of them. They're in every operatory, in the reception area, again, to keep the aerosol count down as much as possible. In between patients, we have UV lights.
Oh, wow.
Again, for a viral, keeping the viral count down. So we have 5 operatories in our office, and so we alternate. We don't. Our office is enclosed. Many dental offices have an open concept.
Sure.
But we're able to do that. The hygienist has an external suction to keep the aerosol down, because she's using electronic scalers, things like that, and again, to protect her and her family, and also to the patients. And the response of it have been incredible. The patients really, really appreciate it. And here in our operatories, we have smaller external suctions to keep the droplet count down within the practice. So we don't see as many patients. We try to alternate. We really, really try to maintain and clean properly.
Yeah.
And I think most dental offices, I know our dental school at the University of Detroit is doing that, and you can imagine 144 students, it's a real challenge. The staff is well protected. We made a significant investment. We invested about $40,000 into the practice for our safety and for our safety of our patients. And so I think that's important. And again, we use the direction of CDC and our American Dental Association, Academy of General Dentistry as a guide. They gave us lists of what we could and should do to protect ourselves, our family, going home to our grandparents and small. I became a grandfather, so it's something that's really important for everybody to know, that going to the dentist is very safe. It's safer than going to the grocery store, for sure.
Wow, and I really appreciate you sharing those pictures with us so that anyone who has been afraid over these past months, like, oh gosh, I just don't know if I can do that right now, you have, brought those pictures, we could show them so that people could understand, look, it's not just the mask, look at all these different things that the office is taking care of. We're taking care of the fact that, we're hearing about aerosolization and we're hearing about, keeping things covered and distance, and showing that. I thank you, because then people can see and say, okay, I can see what they've done.
Chris, and I think if you do have a concern, I think you should not be afraid to see your dentist. But I think that it's okay to call the dentist and ask them what approaches they have taken for their safety. And there's absolutely nothing wrong with that. Even the local dental societies will help direct you on what's proper and what's not proper. And we're here as dentists, we're here to serve the public.
Sure.
And it's important that we're able to do that for our patients.
What has your patient's reaction been? You've made all these different improvements, and I don't know if it's, it is improvements based on the pandemic.
It's improvements, absolutely.
What's the reaction been? What have you seen?
I think, we're very busy, and I think because the patients want to be seen, and I think they're very appreciative. I think that's, they want to know where we bought things. They want to put things in their house. So I know we're hitting home. We're doing things to the best of our ability, because we don't really understand this pandemic completely, but we're doing everything we can to protect our patients. But if you're sick, if you have a fever, you shouldn't be seeing at the dentist.
Sure.
You shouldn't go to your community dentist. There are other sources, hospital dentists and things like that. So just be aware of your own body and your own health. And I think it's important to be honest and open.
Right.
With both your dentist, your doctor, and find out what's going on. It's not the end of the world if you're positive, but we should know.
Right. Well, good advice from Dr. Kosinski. We're going to take another quick break. I know you're going to want to make sure you come back so you don't miss the rest of the show, because we're going to talk a little bit more about the importance of going to the dentist. See you in just a few.
Come on, Randy. Animal shelter, here I come. And no, I'm not crazy or emotionally damaged. That's a stereotype. I just belong to a total loser. I'm a good dog. So if you want a pet, adopt. And if you see Randy, tell him he dropped his wallet.
When life's this hard, it's no wonder 7,000 students drop out every school day. Visit boostup.org and help kids in your community stay in school.
You realize that 49 million Americans struggle with hunger? That's 1 out of every 6 Americans.
These people are around us every day. They're our friends, they're our coworkers, their kids go to school with our kids.
Sometimes we're not even aware that they're struggling. This problem is closer than you think. But so is the solution.
Play a role in ending hunger. Visit feedingamerica.org/hunger and find your local food bank.
I want to see the world.
When you pick up a book,
I used to read every night to all the younger kids,
and let your imagination break free, you won't believe how much fun it can be.
Let down your house.
Experience a world of adventure, excitement, and endless possibilities. Get tangled up in a good book. Explore new worlds. Read. Visit read.gov today.
Welcome back to Celebrate Michigan. I'm Chris Benson, and we're in the studio today with Dr. Timothy Kosinski. Next, we're going to talk about the importance of going to the dentist, even when maybe you don't want to. Dentists have always had a hard sell for some people because there's some people that just are nervous about going, right?
I've never heard that before.
I know, right? Like, yeah. So now during this time, who should be going to the dentist?
That's a really important question. I think that social distancing is important. If you have medical conditions, diabetes, uncontrolled hypertension, you're immunosuppressed for whatever reason, cancer therapy or things like that, obesity, if you're overweight, if you're short of breath, I think you should be very, very, very cognizant of that and be very, very careful of where you're going. Again, going back to what we said earlier, I think if you do have one of those signs or symptoms, you should be looking for a dentist or asking your dentist specifically what they're doing in their practice to protect them. Obviously, dental problems can become very serious, especially in the age of COVID. An infection can become very, very serious and life-threatening. So you don't want to ignore a broken tooth or an abscess or pain or swelling. However, in the age of our computers, we can do virtual exams too, Chris. So you can actually talk to your dentist, and that's what we do, right? Yeah. We can see your mouth and things. Yeah. Or can I postpone my cleaning for a little while? I have the tartar buildup, and then also home care. We can teach a lot of things to improve your home care at home. Send somebody out to get an electric brush or a water pick. Maybe that's not what you're used to using, but if you have time to do that, to try to maintain things. But don't ignore dental problems, because they won't go away by themselves.
And I know how important that is, and I'm so glad that message is getting out, because I think that people during these last months have really tended to kind of put off, either because maybe they're not working right now, or they're like, it's just too dangerous. But it sounds like it can be very dangerous not to go as well.
I think that's the message that I'd like to leave here today. We're here, we're all in this together. I like to say we're on a budget. It doesn't matter what we have or don't have, we're all on a budget. And as a profession, this is more than a job. We should be helping each other out. So, if there are some financial stresses, your children or whatever, I think it's important that you talk to your dentist. We're compassionate people, and we're here to help. This will end at some point, and the loyalty that we can create, I think, is as important to us as it is to you. So, if you trust your dentist, then trust him or her to get the best care that you can, and don't ignore things. But that doesn't mean you have to do everything today, but do what needs to be done to protect yourself and stay healthy. It's a quality of life issue now.
Well, and I think you have done a great job of kind of talking about the different tools that are out there, especially for someone who maybe hasn't been to the dentist for quite a while, and this is a perfect excuse to say, I'm not going now. You've talked about the fact that there's more than just the standard toothbrush and toothpaste and floss. There's all different kind of tools now to kind of help you take care of what's very important. I mean, I know the smile is the first thing people see about you, right? But it's also your gum health and keeping you vibrant.
Right, and your mouth health affects the rest of your body. It can affect your cardiac. It can affect a lot of things in the rest of your body. You really have to take a holistic approach, Chris. And again, it's just important that we understand that it can't be ignored. It's not going to go away. It never gets better. It'll only get worse.
And I've noticed on your website, you've got some great things and tools for people. In addition to kind of a blog area, like a resources area, it looks like you've really taken some time to explain, like, here's what different procedures, what's going to happen, and some YouTube videos. So you've got quite a few out there. Talk about, why did you feel the need to put that on the website?
Well, especially when we had a lot of downtime, it was important that people didn't know. There's things we can do at home for your kids, or for your parents or your grandparents to help maintain their oral health. We can help them do that, and we were all quarantined for a long time. So I think there's just little things that can make things easier and better. Rinses that you can use. It's more than just brushing your teeth for a couple minutes. there's a lot of other issues that we discuss on those blogs and YouTube videos on the website that I think would be very helpful.
And you mentioned children just now. What has this experience been like for them? And I know sometimes, the kid's first trip to the dentist, and with families needing to be in the car, is that still the case for children?
Yeah, well, I think, the whole education thing, the whole school thing, I think there's a couple camps there on what you want to do. But kids are pretty resilient, though. They really are resilient. Wearing masks, it's just a part of their lives right now. And they'll do what the adults say. Again, be conscious of your health of your child, and if you're unsure, if you're uncomfortable, again, virtual exams are phenomenal. Again, this will end, and we can get back into a routine. I'm more concerned with people that have serious health issues or serious dental issues. The aesthetic work, those type of things, we can postpone that if needed.
Well, we're just about ready to wrap up. What is the last thing you want to leave people with as you're thinking through where we are now, and as we're filming this, it's almost the end of 2020. I can't believe it already, but I know a lot of us are waiting for that. What do you want to leave people with?
Well, Chris, thank you for allowing me to do that. I think that, again, as dentists, as doctors, as first liners, we're healthcare professionals, and we're here to help the public. Our communities, we're part of the community. We want everybody to be safe and comfortable and be safe, be smart, wear a mask, social distancing. Those things are important for all of us to understand.
Well, thank you so much for saying it again. We need to hear it again. Unfortunately, the time has come to an end. We're so glad Dr. Kosinski was here with us to give us insight into what the current dentistry regulations are right now. We're glad you watched us here at Celebrate Michigan, and we can't wait to see you next time, where all the great things that happen in the Mitten State, you can see them here. Take care.